broadcasting the sparks that ignite vocational rehabilitation through the inspiring stories of people with disabilities who have gone to work,
working in a field that I understand,
as well as the professionals who have helped them.
A job and a career. You got to look at how life-changing this is.
And the businesses who have filled their talent pipelines with workers that happen to have disabilities.
To help expand registered apprenticeship.
These are their stories.
Because there's such a great story to tell about people with disabilities.
Now, here are the hosts of the VR Workforce Studio, Rick Sizemore and Betsy Civilette.
March is Brain Injury Awareness Month, and today's conversation is about something deeply human, how lives can change in an instant and how people rebuild, adapt, and move forward with strength and support. Brain injury can happen to anyone at any time. For some, recovery is quick. For others, the effects last months, years, or even a lifetime. And those effects don't just impact the individual, but families, relationships, and the entire support system.
Right. And here in Virginia, the Department for Aging and Rehabilitative Services, or DARS, works alongside partners across Virginia to support individuals and families navigating life after brain injury. And today's conversation brings together our lived experience, family perspective, and system-level support.
We're honored to welcome Kelly Lang, brain injury survivor, caregiver, advocate, and co-author of The Miracle Child, Traumatic Brain Injury and Me, as well as a contributing author to a new national guidance document on communicating about brain injury. And from the DARS Brain Injury Services Unit, we're joined by Donna Cantrell and Amy Loving. Welcome to you all. It's great to have you on the show.
Thank you for joining us.
Thank you so much.
Thanks for having me.
Kelly, let's begin with your story. You and Olivia, your daughter, who's not with us today, were both involved in a serious accident. Can you share what happened and what that moment set in motion for your family?
Sure. Thank you. I have no memory of the actual accident, so that part I am only telling you through witness testimony.
Okay.
But we were hit from behind. I was stopping at a yellow light, and I was in the third lane from the right, and the car that hit me also hit two cars before me, but I never saw that. I never saw him coming. I don't remember. And he pushed us through roads of traffic about 80 feet into a guardrail. So we had what they call a double impact. And when the EMTs arrived, I remember hearing them because I woke up to my 5-year-old daughter yelling, "Mommy, Mommy, wake up." But I knew something was wrong with Olivia, my 3-year-old. Inherently, I remember yelling to them that they had to save her. And that's what they did. They pulled her out and rushed her to the ambulance and took her to the nearest hospital. And when I arrived and woke up in the emergency room, I learned that she was going to be transferred immediately to a Trauma 1 hospital because she had severe injury. I did not know that they didn't expect her to make it to that next hospital, and that's why they asked me to find someone who could ride with her because I was not going to be discharged, and my husband was on a consulting job, and he was flying back into town that night.
Wow.
Wow. That is very traumatic. I'm sorry to hear that. But we're glad you're here.
Yes.
And Olivia as well. And if you're comfortable, what would you like people to understand about your journey?
It's been, I say brain injury is like an ocean. It ebbs and flows. You can be going up and up and up, and then you plateau or you go down. And I had to learn that the hard way. This was back in 2001. There wasn't a whole lot that was known, but I had never heard of traumatic brain injury. And then to be told that my daughter had one and they didn't know if she would ever wake up, and if she woke up, what she would be like. And then to find out 2 months after she came home from inpatient rehab that I too had a brain injury that had not been diagnosed. But I was lucky. My primary care physician figured out what was going on very quickly and referred me for neuropsych testing. Not a lot of people don't get that, especially, they think, oh, it's all in your head or you're just tired or, she kind of recognized the signs very early that no one else. So I'd been in her hospital room 24/7. No one picked up on it. inpatient rehab. I was just the traumatized, in shock mom.
Well, you were at that point, fulfilling your primary role in the world to be a mom, right? I mean, you probably didn't even stop to think about yourself. But from that standpoint of being a mom, what did you learn about brain injury that you simply could have never understood until you went through it?
The one part I learned about brain injury is how different it can be, and also it can be so different from hour to hour, to day to day. And that was something that no one ever told me. A lot of the education I got was my own educating myself about what brain injury was, how I could help her, and that there wasn't a whole lot, and there still isn't a lot of research on pediatrics and what the trajectory is. So every doctor would tell us something different. Um, and so I pieced together our recovery plan or her recovery plan, trying to find providers, trying to find not just pediatric, but also brain injury competent. Um, and, try to, her going through the public school system, trying to piece together all her accommodations through the years and then finding services in the state. Um, we did not get connected to DARS until she was in high school. Um, that was part of the transition, and I had to actually notify the school to notify DARS to get her
Mhm.
into services. And now I tell people all the time who have children with disabilities, not just brain injury, that DARS is there, and you should be contacting them and using whatever services you're eligible for because it is a good resource.
Well, thank you for
Exactly.
spreading the word. We really appreciate that. Certainly. And what I hear very often is that, a brain injury can be invisible. It's a, invisible disability or condition. Where do misunderstandings show up the most? And how does that affect recovery?
I think, well, in Olivia's case and in my case, we both look like your average person. I mean, she doesn't have any scars on her. She does not have any noticeable physical disability. And so I think when it comes out is when they start to talk to her for a longer period of time. Some of the cognition issues, some of the processing issues, they start to show up as she fatigues through the conversation. And it was the same thing in the schools that they didn't believe me. I mean, even though I had the medical documentation, they were like, "Oh, this mom,
She
she doesn't
looks
know what
fine.
yeah, she's totally fine. She's a nice
Right.
kid, she's quiet, she wasn't disruptive." And then they would come back to me a couple months later and go, "Oh my gosh, thank God you gave us training because we started to see as we got to know her what some of her difficulties were." And then, and I can't tell you how many times teachers came up to me and said that, which is why I kept going and advocating and trying to educate them about brain injury because a lot of them had no experience.
Yeah.
Right.
That's what makes your story so powerful is that you've been on this pathway. Obviously, this interview is not about me, but I was in a car wreck hit at 100 miles an hour from behind. So I have some ability to relate to what you're saying. I have a very, very close family member that had a tree fall on his head, 167 stitches from his scalp to the back of his head. It comes into your life and then you're in it and you're walking this path without a lot of warning. What are you most proud of in terms of this journey that you've been on uh, with Olivia as her mom and yourself, a person who's uh, impacted by brain injury?
I'm proud of the support system I've built. I do think the community and family support, friend support is a huge factor in recovery. I actually don't like the word recovery because I don't know, like you said earlier, some people just they never fully
Yeah.
recover. She'll have,
Right.
it's a chronic condition. Um, And I'm proud of that. I'm proud of how I was able to piece it together. I think we did everything we could possibly do. I'm always looking for that little thing I might have missed even now. And she's, we're 24 and a half years out. I still look for like, is there something we missed that no one picked up on? But I think I'll do that the rest of my life, quite honestly. I'm a mom. That's really what we do. So I'm proud of that. I'm proud of all the advocacy I've been able to build throughout the years in this state and also in the nationwide. And I'm proud of a program developed with a friend who's also a brain injury survivor, training new people in the field of how to become a more active stakeholder, how to advocate for yourself, and how to build their self confidence, because that wasn't around when we both started.
Well, Kelly, I'm sure people listening will be extremely grateful for your advocacy
Thank
and
you.
education, including your book, The Miracle Child, shares your story. So, what moved you to write it, and who did you write it for?
I wrote it for the parents out there who have a child with a disability. It's not just for brain injury, but it's also, if you have a disability, you have to go down this road also and advocate for your child. And it started because someone gave us a journal when we were in the hospital. And my husband and I used it as a communication tool between the two of us so that when we would trade off to go home with our other daughter. And so then I saved it and I kept writing in it, as things happened. And a couple people had said, I was on the Brain Injury Services Speakers Bureau, and they said, you should write a book that never heard the story of the mom and the daughter both being injured in the same accident. So it took us a long time, but COVID actually helped us to like sit down together because we are both home all the time and to actually finalize it. And it's written in a diary format so that it's his perspective and my perspective, which was quite different as the mom and the dad, we both approached it very differently, but it worked.
Yeah. It's an amazing book. You can certainly find that online. I would encourage anyone who has any interest in this topic to get that book and read it. Donna, let's connect the story to DARS. What does brain injury services through DARS look like in Virginia?
One thing Kelly didn't mention is that she's a very active participant in the Virginia Brain Injury Council. It's a stakeholder group made of professionals, caregivers, individuals with lived experience of brain injury. And she's been on that, Kelly, since 2021.
Yes.
2021. And so, we just value her. She has also had a program that we used for new members on council called Get On Board. The Virginia Brain Injury Council is an advisory board to DARS and to a federal grant that we have. And then new members who are survivors of brain injury and caregivers often don't have a lot of experience on, formal boards and things. So Kelly and another colleague of hers came up with a program designed to help, and to let them practice how to participate on a board. And it's been very valuable. The members have gained so much from it. So I just wanted to mention that on the federal side, and Amy's going to have to do the state services.
Virginia is really unique in that they have full state coverage of services for folks with brain injuries. Case management is covered through the state general funds and is everywhere in Virginia. So that means that there's access to services no matter, where you live. There's other services also that include day support and clubhouse services, and those are more daytime services for folks that have brain injuries. And they really work to meet the needs of the individuals, their families, the specific things that are going on, and meeting those needs that Kelly mentioned that do change every day. And so the group itself works together. They're all nonprofits across Virginia. And really, their hope is to provide that support to individuals and families that have the brain injury, and make sure that they, are working towards those independent skills that they want to accomplish and the goals that they want to work on.
Amy, when you hear a story like Kelly and Olivia's, where do you see that our agency system intersects with families like theirs?
Kelly's story is very powerful, and I've gotten to hear her speak at several conferences and different roles of advocacy. And, her story is just so powerful and brings home, all of those supports that are really, really needed in the community. Making sure that, the system as a whole is meeting the needs of the individuals. They do have a voice in the services and their goals and the things that they want to work on, and that their individual needs are being met. We
Okay.
really try to focus on person-centered care, and ensuring that each individual and their families have that support, have that education, have the resources that they need. And there's one agency in particular in Virginia, Brain Injury Association of Virginia, that also supports in that resource coordination. They also support ongoing education and advocacy in Virginia for people with brain injuries. And so Virginia is very lucky to be able to have those wraparound services for individuals.
Yeah. I don't think we can overstate the value of getting a service in the community you live in. You spoke briefly about community-based programs, but give us some examples of the services that are actually occurring in the day that a person steps through the door at a community-based program. What are they actually going to experience there?
Individuals would come in, they could reach out either online or by phone, or even, showing up for an intake. So reaching out to those individual agencies that serve the areas that they live in. And as soon as they come in, they're greeted with, understanding and listening ears, and really trying to work with the individual on, what are those priorities for them, and what are those specific needs. When they do come in, they go through an intake process, which is, very painless and easy. So they help walk the person through it. A lot of times folks with brain injuries, may have some challenges or difficulties completing paperwork and completing intake forms. And so they really have that hands-on help in that moment to complete all of those things. From there, they have the option of the different services. So the case management services, day support, clubhouse, whatever is provided in that area. The one thing that is guaranteed is the case management in all areas. The other cool thing is that each individual area in Virginia also gets input from their stakeholders and the people that live in their areas. And so they're able to kind of build the services based on what the needs are for each individual community.
Cool.
Well, if someone listening to this says, that sounds like me or my family, what is the first step that they can take?
So we do have on our website the map of Virginia. You can find your individual county that you reside in, and that will take you directly to the information about the agency that covers the services in that area. There's also a drop down if that's an easier way to access that information. Additionally, there's information that populates as well about the Brain Injury Association of Virginia for additional resources that individuals may be looking for.
Yeah. Amy, one last question before we move back to Kelly. What would you add about how these services are evolving, especially with brain injury now being recognized more broadly as a chronic condition?
Yeah, so we're all the time looking at the services, looking at what we can do to enhance it, looking at stakeholder feedback, and individuals and families that have brain injuries and are, dealing with that on a daily basis, and making sure that their voices are heard, and that the supports that they're needing are available to them in the community. The providers and DARs work together to come up with creative solutions for different things that might come up, and challenges that might the individuals may be continuing to face in different barriers. So we're all the time adjusting. We're all the time working together to make sure that people with brain injuries do have the support and the help that they need.
Yeah. Thank you.
Well, Kelly, you were one of the authors of a new national guidance document on communicating about brain injury. So what is this document and why is it needed?
Well, the whole project was started by Dr. John Corrigan, who's with Ohio State University, and he's a premier in the brain injury field. He's been working in the field for many years. And there a lot of questions were coming up because we've been trying to get brain injury recognized as a chronic condition. And the Centers for Medicare have recognized it, but the CDC has not as of yet. So there were a lot of questions around that, and he and some other colleagues decided it would be best if a bunch of different brain injury organizations, including Ohio State, the TBI model systems, which actually are represented on that, is from Virginia Commonwealth University and from our state, and then Brain Injury Association of America and a couple of other researchers in the field, as well as 4 people with lived experience. And I was one of the people with lived experience. And it started out, it was going to be a 6-month project. We were going to write a statement. We were going to have points just explaining what brain injury is and some of the misconceptions. Well, 2 years later, we're still meeting monthly. We're still coming up with ways to disseminate the information, to tweak
Because it's
it.
valuable.
It's very valuable, and we're getting lots of great feedback on it, mostly positive. And so it just goes through 12 different points that how to talk about brain injury. Because a lot of people, I've experienced this. I'm sure Donna can also, say that sometimes people just they don't understand brain injury because you can't see it. It's not a broken arm. It's not anything like that. It's all internal and it's hard to explain. And, people complain that their families didn't understand it. Their doctors don't understand it. Because their doctor only sees them for a very short period of time, maybe once a year, and they don't see what they go through on a day-to-day basis.
Exactly.
And that it's, even though it's chronic, doesn't mean it's static. That there's going to be, there'll be peaks and valleys with anything. And that, it's also does not mean you have a full disability. It can be a disability, but it doesn't have to be, just depending on your injury. And we had a long conversation yesterday about the first point, which talks about the classifications of mild, moderate, severe, because those have always been very misleading. Because a mild injury does not leave a person with a mild disability. It can be very severe for some people, and a very severe injury, someone can recover a lot. So they're trying to change those terms and change the perception of what that all means.
Right. No, I can understand. I've fallen on my bike, hit my head. I thought, oh, it's nothing, but it cracked my head. I had a mild concussion, but still, yeah, just something little can really impact. You don't realize it. But one thing that stands out is the idea the words we use matter. How can language affect outcomes for people with brain injury?
Well, I think it can, as the mom of a daughter, I was always very clear on what the appropriate term was. If someone ever used a derogatory term towards her because she processed information slower, I was called a mama bear at one point, and I took offense. And now, actually, I wear that very proudly. That I came out as a mama bear. Like, that is not appropriate. That is not what is going on. This is a brain injury, and these are the symptoms. So I feel like even though we've come a really long way in 24 years, we have so much more to do, and so much stigma is still there that I really hope we can start to wrap around our arms around it and take people for what they are. And so many have so much to offer our world in kindness and compassion and everything else, and their stories matter, that I really hope that we can continue to embrace those.
Yeah, absolutely. This document, I believe, is so important at this time in our history. It explains that brain injury is a physical injury, a chronic condition, a disability. Why is this distinction so important?
I think it's important because there's a Venn diagram on there that, where all the circles interlap and showing that it's not just one thing. It's not a once and done. You don't, a lot of people don't fully recover. I had someone say to me 2 years later, "Oh, I'm so glad it all worked out." And I had no response because it hadn't all worked out. But it looked, to the outsider, it probably did look like everything was great. Um, and just continuing to educate that you can have these symptoms for the rest of your life. And again, ebbs and flows. Sometimes the symptoms are very minor and very, doable. And at other times, the fatigue can be so crushing that, people can't function. Um, so I, I think education is what it's all about.
I would add to the communicating on brain injury document is something that DARS, Brain Injury Association of Virginia, and the Alliance of Brain Injury Providers in Virginia all fully support. And it's a document that's not just trying to reach support providers of people with brain injury or, their immediate family. It is also trying to reach the doctors, rehab clinics, and, far and wide, people we probably, don't even think about would need to know that information, schools, everything. And so this document really is, the idea is to really pass it out, to really keep that conversation going, to really wrap our heads around this as a chronic condition, and that
Right.
folks really are, doing the best that they can every single day and should be treated as such.
Mhm. Well, I love how the document emphasizes that brain injury does not define a person.
No.
And how should we be talking about individuals instead?
Well, one thing I've always said to my daughter is that your brain injury is a part of you. It doesn't define you.
Right.
And so you are so much more than just your brain injury. And it's taken a long time for her to understand that and exactly what that means. And I think she's finally embraced it. But it's just a part of you, just like I have blue eyes. Well, it's just a part of me. It doesn't define me. And so I think knowing that you are so much more than your brain injury, because you have so much more to offer. I mean, you have, so many other parts of you to bring forward. And yes, your brain injury informs you. So you might be more compassionate, you might be more cognizant of your disability or, what it has brought to you, but you are so much more than that.
Right. Well, for those listening to this show today, I'm sure they want to know about how Virginia plans to use this new guidance document. Donna, Amy, Kelly, how do you see this being used as we move forward?
I personally am visiting with support groups. I've reached out and I've presented at a few already, and I am actually trying to get it into the public school systems and especially the clinics, because there's a misconception that all the brain injuries in schools happen during athletics, and that's not
Right.
true.
Right.
There's kids that are being, unfortunately, victims of domestic violence. Kids fall on skateboards. They hit their heads all the time. Um, and we need to be aware. Everyone in the schools needs to be aware of what to look for and how to talk about it. So that's personally how I have been using it. But I'm sure Donna and Amy have other.
So Amy and I have been talking about, how we're going to actually use this document. It's a relatively new document. I mean, I guess it probably hit the streets for branding about a month ago, maybe. So we're just now getting it printed and working on a plan of how to use it. I know that we're going to distribute it to the state-funded programs and ask them to distribute it, in their areas of expertise. Amy and I are going to use it as we go out into the world to, do our work in some of our outreach events. Amy, did you have other thoughts on that?
Yeah.
It's
And
really
it's
very
also,
new.
yeah, it's going to be added to our website as something, as a document that can be accessed by anybody in the community for that additional resources, that additional information and education. That's really important when they're, encountering people that do have a brain injury and in some ways any disability.
Yeah. So that'll be at dars.virginia.gov. And we'll also sort of put some alerts on our DARS Facebook page when our DARS Facebook as soon as that becomes available.
Yes.
Well, Kelly, Olivia, I know Olivia's with us in spirit today. Thank you for your courage, your story, and your leadership.
Thank you. I appreciate it. Thanks for having me.
Yes. And Donna and Amy, of course, thank you for your expertise, the work you do every day to support individuals and families living with brain injury across Virginia.
If you'd
Thank
like
you
to learn
for
more,
having us.
visit DARS Brain Injury Services. You can find that at our website, dars.virginia.gov. explore Kelly's work at themiraclechild.org and watch for the release of this new national guidance document.
Thank you guys for joining us for this special Brain Injury Awareness Month episode.
Until next time, on behalf of Betsy Civilette, I'm Rick Sizemore. This is the VR Workforce Studio.